Hi, my name's Tom Lomax. I'm a medical doctor currently practicing in Tokyo, and this is a short video which is aimed at parents who are considering getting a COVID vaccine for their child age bracket 12 to 18. And I guess it would also be helpful for children aged 12 to 18 who'd like to know more about COVID vaccine before potentially they get one. So I'm trying to keep this fairly simple, and I'm just going to go through the three questions that I think first of all come to mind when we're approaching the decision to get a vaccine. First of all, of course, does the vaccine work? Is it going to protect us? Secondly, is it safe? And thirdly, is this vaccine appropriate for children? Specifically, the vaccine might be great, extremely helpful in older people, but is it a good idea for it to be given to a 12-year-old? So let's get into it. First of all, how well do these vaccines work? So I've decided, first of all, to look at the UK. And the reason for that is the UK's had a lot of COVID, significantly more than Japan. And it's also rolled out a very successful vaccine campaign, started rather earlier than Japan's. So let's look at two things. Let's look at the total number of cases that have occurred in the UK, and then let's look at mortality, the total number of deaths that have occurred as a direct consequence of COVID infection. So the UK's had two significant waves of COVID going up to the start of the vaccine campaign. The first one was in the first part of 2020, and the second one over the winter that we've come through. Both of those waves were associated with a lot of deaths. The first wave peaked at about 1,000 deaths per day, and the second wave peaked in January and February, during which time in the UK there were approximately 1,500 people dying of COVID every day. So far, far more than Japan. Well, what happened as a consequence of that is, to end the second wave, the UK had a very strict and rather long-lasting lockdown. During lockdown, the vaccine was rolled out. Then in July, lockdown ended, people were allowed to circulate more freely, and the Delta variant had started to circulate in Japan, so we got into a third wave of cases. So there we go, you can see the third wave is still going on, and it's basically been running in the UK in June and in July. The difference was, though, that by the time the third wave hit, about 70% of the UK population had been vaccinated. Now, what was the consequence on the number of COVID deaths? Well, there you can see the number of deaths was far, far less, whereas the second wave caused maybe 1,500 deaths per day. Approximately 100 to 150 people at peak died from COVID during the third wave, and that's because most people had been vaccinated. People who did die from COVID, by and large, were people who'd chosen, unfortunately, not to get vaccinated. So we can look at the UK data and say that COVID vaccination has reduced deaths from COVID infection by over 90%, which is really very impressive. COVID vaccination in the UK has saved tens of thousands of lives already, and it's going to continue to save lives into the future. Okay, fine. That's the UK. How about Japan? Japan's had rather a different story with COVID, and as most of us are aware, particularly in 2020, far less COVID infections. Let's have a look at the numbers again, doing the same exercise before and after vaccination. So we'll look at case numbers, we'll look at mortality. Japan had 4 waves of COVID, and the more significant ones were January of this year and then April of this year. And they peaked at about 6,000 or 7,000 cases per day, and they were associated with a mortality, deaths of perhaps a peak of 100 to 150 people per day. As we all know, COVID vaccine was rolled out in Japan, although rather later than in the UK. Nevertheless, by the end of July, most of the elderly and medically vulnerable people had been vaccinated. Then we got the Delta wave, and here it is. So Delta wave in Japan caused about 4 times as many infections as previous waves. Delta wave peaked at about 20 to 25,000 infections per day. How many deaths has that caused? Well, let's have a look. So as you can see, although there were 4 times as many infections in the 5th wave, which we're still in at the moment, deaths are perhaps half as much as previous waves. So again, vaccination has been extremely effective. And again, if you look at the data in detail, people who've unfortunately died from COVID in Japan have almost exclusively been people who chose not to get vaccinated. So, you can repeat this exercise pretty well for any country that's used mRNA COVID vaccines: Israel, the US, a lot of European countries. And you tend to get the same answer. Vaccination is consistently over 90% protective against death from COVID. Vaccination is consistently over 90% protective against severe disease, COVID hospitalization. Vaccination is rather less effective at preventing mild disease. We see a lot of breakthrough infections, but they're typically mild or even have no symptoms at all. And for this reason, despite vaccination, COVID is going to continue to circulate, and we're just going to need to learn how to adapt to it. Okay, I think there's relatively little doubt that vaccination's been effective, but some people, of course, do worry about safety of these vaccines. I'm going to look at a few questions that specifically relate to safety. First of all, and I think particularly this is relevant for the foreign community because they followed this in the foreign media, blood clots. So this really came again from the UK, which reported that out of every million vaccines given with the AstraZeneca vaccine, about 12 people would develop a blood clot. Of those 12 people, about a third would get a cerebral venous sinus thrombosis, which is a blood clot in the veins around the brain. That's relatively serious and will have a mortality, will kill a person who gets this about 18% of the time. So that's not trivial, but there's no question that despite this, COVID vaccines in the UK have saved far, far more lives. You'll also see that there's been an association between the J&J vaccine used in the US and blood clots, although it's a much weaker association. Your risk of a blood clot with a J&J vaccine is perhaps a bit less than 1 in a million. However, two things to consider about blood clots. First of all, COVID infection itself will increase your risk of developing a blood clot by 41 times. A lot of people will get a blood clot because of a COVID infection. And there's no association between the mRNA vaccines, the ones that are being used in Japan, made by Pfizer and Moderna, and blood clots. And as these vaccines have been given to hundreds of millions of people, by now we have enough data to say this with confidence. Let's move on to the second safety question that I get asked about a lot. And this is myocarditis. So myocarditis means inflammation of the heart muscle. A lot of us who had a Pfizer or a Moderna vaccine will have got muscle aches. I remember when I got my second dose of Pfizer, I had quite a bad muscle ache that lasted for a day or two. Myocarditis is basically the same thing. It's a muscle ache, but unfortunately it's one that affects your heart muscle. This will happen more commonly in younger people, and in the US has been reported in about 12 cases per million vaccine doses delivered, most commonly in ages 12 to 39. If you're over 40 and you get an mRNA vaccine, your risk of myocarditis is perhaps 1 in a million. Unlike the blood clots, which happen more commonly in women, myocarditis happens more in men. And it will typically present as chest pain, normally 2 or 3 days after receiving a vaccine. Most cases of myocarditis are quite mild. Usually people who get myocarditis are admitted to hospital for observation. They may be kept in hospital for a few days, and they'll be given symptomatic treatment, basically anti-inflammatory painkillers, drugs like ibuprofen, but no other treatment is required. So far, no deaths have been recorded as a consequence of myocarditis. A couple of important considerations here. COVID, again, the infection can cause myocarditis. And in one study in the US, people who are hospitalized with COVID, up to 20% of them had evidence of damage to heart muscle on their tests, ECGs, or on the basis of chest pain they experienced. Now, let's go on to the other safety concern that, again, is reported in the media quite commonly, which is deaths after vaccination. So most countries, including Japan and the US and the UK, have got a very robust system to record all deaths from any cause if they occur after a vaccine. The US system, that's the Vaccine Adverse Event Reporting System, VAERS, has so far recorded over 7,000 deaths after vaccination, but that's from a total of almost 370 million vaccines that have been given. So that's a sort of raw risk of 0.002%. Does that mean that if you get a vaccine, there's a 0.002% chance that it will kill you? Well, absolutely not. So these systems record all deaths, even things like suicide that are unrelated to getting a vaccine. So especially if you look at more vulnerable people, medically frail people, or the elderly, there's a natural background rate of deaths that will occur independent of people being given a vaccine. And other than for the blood clots, which we've discussed already, there's no causal link identified between deaths and vaccination. So we think that by and large, these deaths that are being recorded after vaccination are random events and they're not related to the vaccine being administered. Okay, on to the last question about safety. So this one is a little bit more nebulous, and this is that somehow mRNA vaccines, again, that's the Pfizer and the Moderna vaccines, might alter our genome. And this leads on to concerns that these vaccines might have unpredictable side effects that won't become known until years down the line. Particularly, they might affect our fertility. So let's be really clear about this. mRNA, which is the active component of the vaccine, basically it enters a cell, gives the cell an instruction to make a protein, and it's the protein that then generates the immune response. And then the mRNA is destroyed. And mRNA is destroyed in cells really very quickly, usually within a few minutes. mRNA doesn't interact in any way with DNA, with our main cellular genetic material. And in fact, mRNA doesn't enter the genome, doesn't enter the component of the cell where our DNA is stored. So although mRNA vaccines are relatively new in the sense that they're being used for mass vaccination for the first time, the technology that underpins them is quite well understood and has been around for a very long time. As such, I believe, and pretty well any other medical doctor you ask will agree with this, there isn't any potential for these mRNA vaccines to cause side effects at a delay of years. Okay, so that's my thoughts on safety. It's not comprehensive, but those cover the main issues that people will discuss with me in my office. Let's look specifically now at how appropriate these vaccines are for 12 to 18-year-olds. So some people say, well, COVID in children is quite often very mild. So why can't we just let children catch COVID naturally and get their immunity that way? Let's have a look at COVID cases in Japan. So this is a breakdown of the number of cases that have happened in Japan by age. And as you'll see, the highest number of infections in Japan, as in many other countries, have occurred in people between the age of 20 to 29, with then decreasing numbers of infections in people in their 30s, 40s and 50s. And then behind them, infections occurring in people aged 10 to 19. So far in Japan, when I collected this data, which is about 2 weeks ago, there'd been about 150,000 infections in this age group. I think 142,000. And actually, although this says no deaths, early in September, one death in a 16-year-old was recorded in Japan. So that person, unfortunately, is the youngest person to die from COVID in Japan. So it seems that relatively few 10 to 19-year-olds get COVID compared to older age cohorts, and that typically, death in that age group is very rare, but serious infections can occur. So this is multi-system inflammatory disease, or MISC, which can occur in children. It's not very common, but it can be extremely severe. So this is basically when COVID infection causes an inappropriate overactivation of the immune system, and this immune response then damages various different parts of the body. It can cause a really nasty rash, it can cause inflammation of the eyes, but it can also cause damage to kidneys, and it can cause damage to the heart. So this is what's killed a small number of children in the US, in the UK, and in other countries. And it probably happens overall in about 2 to 3 children per 100,000, but actually slightly more commonly in teens. It probably has a peak age incidence of 13. And as I said, it can cause some permanent health issues. So it can cause aneurysms to form in your coronary arteries, the arteries that supply blood to your heart muscle. Okay, so if we sort of accept that, serious infections and sometimes even death can occur in children, but we still decide not to vaccinate children, then what do we think would happen across the population? Well, we kind of know the answer to that already from what happened in the UK. So let's jump back to the UK and let's have a look. In the UK, vaccinations were staggered in intervals, more than was done in Japan. When vaccine first became available at the end of 2020, initially it was only offered to healthcare workers and people over 80. So if you look at this graph, the line on the far left in dark red, that's the vaccine uptake in people over 80 years of age. When we go into 2021, which is week 1 on this graph, you'll see that gradually the age at which vaccines were offered was dropped. So vaccination invitations were extended to 75 and above, then to 70 and above, then to 65 and above, and so on, until we get to the right side of this graph and we look at the dark blue line, which is vaccination of people aged 40 and above. So basically, when the vaccine had been offered to and given to most people above 40, that's when Delta variant really took off in the UK. And this graph shows the number of infections by age that was caused by the Delta variant. So unsurprisingly, older age cohorts, which are on the lower part of this graph, relatively few infections because most people have been vaccinated. The top line is 20 to 29-year-olds. So we saw a very high number of infections in that age group. But right below that, the second line in the lighter red is infections in people aged 10 to 19. So those two age cohorts accounted for a very large majority of infections that happened in the UK after vaccination as a consequence of the Delta variant. And that will definitely have caused fairly significant disruption, particularly to education, and may continue to do so. Let's think back to what happened in 2020 when we didn't have a COVID vaccine and our only response was to restrict movement. So we had school lockdown in the first half of last year, and those of us who are children or have children in our households will remember that we were trying to do distance learning, and that for a lot of people that was a real struggle. Beyond that, a lot of children found it quite stressful, and there's a lot of good data now that shows that a lot of school-aged children felt lonely, anxious and insecure during lockdown. A lot of parents reported that children's mental health deteriorated. I've experienced that myself in my patient group. And finally, there's some really good data now that shows that as a consequence of distance learning, a lot of students really fell far behind on a lot of basic educational skills. So I firmly believe that vaccination of 12 to 18-year-olds offers the best chance to keep schools open now in 2021 and beyond. And I also think vaccination should allow older children to socialise, to hang out with their friends, and to participate in activities like sports and so on with greater safety. I think it's much more appropriate for school activities that involve an increased risk of COVID to be conducted in vaccinated school population. Okay, so here's my 3-point summary. COVID vaccines are effective. They protect us against death and they protect us against severe disease. The cost benefit strongly pushes us towards choosing to get vaccinated. Vaccination also helps to limit the spread of COVID in schools will help to reduce school closures and will help to prevent the psychological problems that can occur as a consequence of school closures. There are rare side effects, but again, cost benefit strongly weights us towards getting vaccinated. Okay, that's all I've got to say. Thank you very much for listening. And of course, if you do have any comments or questions, please feel free to post them in the section below. Thank you, and please stay safe.